Sickle Cell Anemia, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Sickle Cell Anemia, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of sickle cell anemia. Chapter 1. 1. What is anemia? Anemia is a lack of healthy red blood cells. 2. What is sickle cell anemia? Sickle cell anemia is a disease that affects the red blood cells. 3. What are the functions of the red blood cells? The red blood cells transport oxygen from the lungs to the body and removes carbon dioxide from the body. 4. What is the function of hemoglobin? Hemoglobin allows the red blood cells to transport oxygen around the body. 5. Is hemoglobin a protein? Yes, hemoglobin is a protein. 6. Why is it important for hemoglobin to be flexible? It is important for hemoglobin to be flexible because it makes it to easily move through blood vessels. 7. What happens to the red blood cells in sickle cell anemia? In sickle cell anemia, the red blood cells become sickle in shape. They become rigid and sticky, thereby affecting normal blood flow. 8. Is sickle cell anemia an inherited disorder? Yes, sickle cell anemia is an inherited disorder. 9. What is the normal shape of red blood cells? Red blood cells are normally round. 10. Are red blood cells normally flexible? Yes, red blood cells are normally flexible. Chapter 2. 1. What is the normal duration of red blood cells? The normal duration of red blood cells is about 120 days. 2. What is the duration of red blood cells in a person with sickle cell anemia? The duration of red blood cells in a person with sickle cell anemia is between 10 to 20 days. 3. What are the signs and symptoms of sickle cell anemia? The signs and symptoms of sickle cell anemia are extreme pain, fatigue, problem with vision, frequent infections, slow growth, late puberty, swelling of the hands, swelling of the feet, etc. 4. Can pain in a person with sickle cell anemia become chronic? Yes, pain in a person with sickle cell anemia can become chronic. 5. How is sickle cell anemia diagnosed? Sickle cell anemia can be diagnosed by blood test. 6. Can sickle cell anemia be diagnosed before birth? Yes, sickle cell anemia can be diagnosed before birth. 7. How can sickle cell anemia be diagnosed before birth? Sickle cell anemia can be diagnosed before birth by taking a sample of amniotic fluid from the pregnant mother. 8. Can sickle cell anemia lead to high blood pressure? Yes, sickle cell anemia can lead to high blood pressure. 9. What is another name for high blood pressure? High blood pressure can also be called hypertension. 10. Can sickle cell anemia lead to miscarriage in a pregnant woman? Yes, sickle cell anemia can lead to miscarriage in a pregnant woman. Chapter 3. 1. Can sickle cell anemia lead to premature birth? Yes, sickle cell anemia can lead to premature birth. 2. Can sickle cell anemia lead to stroke? Yes, sickle cell anemia can lead to stroke. 3. What is a stroke? A stroke is when there is a block of blood supply to a part of the brain. 4. Is a stroke life-threatening? Yes, a stroke can be life-threatening. 5. Can sickle cell anemia lead to breathing difficulties? Yes, sickle cell anemia can lead to breathing difficulties. 6. Can sickle cell anemia lead to blood clots? Yes, sickle cell anemia can lead to blood clots. 7. Can sickle cell anemia lead to deep vein thrombosis? Yes, sickle cell anemia can lead to deep vein thrombosis. 8. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in a deep vein. 9. Can sickle cell anemia lead to impotence? Yes, sickle cell anemia can lead to impotence. 10. What is impotence? Impotence is erectile dysfunction. Chapter 4. 1. Can sickle cell lead to priapism? Yes, sickle cell anemia can lead to priapism. 2. What is priapism? Priapism is a painful erection that lasts for a long time. 3. Can sickle cell anemia lead to pulmonary embolism? Yes, sickle cell anemia can lead to pulmonary embolism. 4. What is pulmonary embolism? Pulmonary embolism is a blood clot in an artery in the lung. 5. Can sickle cell anemia lead to pulmonary hypertension? Yes, sickle cell anemia can lead to pulmonary hypertension. 6. What is pulmonary hypertension? Pulmonary hypertension is high blood pressure in the lungs. 7. Can pulmonary hypertension be life-threatening? Yes, pulmonary hypertension could be life-threatening. 8. Can sickle cell anemia lead to organ damage? Yes, sickle cell anemia can lead to organ damage. 9. Can sickle cell anemia lead to gallstones? Yes, sickle cell anemia can lead to gallstones. 10. What are gallstones? Gallstones are stones formed in the gallbladder. Chapter 5. 1. Gallstones are also called cholelithiasis. 2. Can sickle cell anemia cause muscle cramps? Yes, sickle cell anemia can cause muscle cramps. 3. Can sickle cell anemia cause hematuria? Yes, sickle cell anemia can cause hematuria. 4. What is hematuria? Hematuria is the presence of blood in urine. 5. Can sickle cell anemia cause pruritus? Yes, sickle cell anemia can cause pruritus. 6. What is pruritus? Pruritus is itchy skin. 7. Can sickle cell anemia lead to ulcers? Yes, sickle cell anemia can lead to ulcers. 8. Can sickle cell anemia lead to blindness? Yes, sickle cell anemia can lead to blindness. 9. Can sickle cell anemia be treated? Yes, sickle cell anemia can be treated. 10. What are the treatment options for sickle cell anemia? The treatment options for sickle cell anemia are medications to treat pain crisis, medications to prevent infections, blood transfusions, and bone marrow transplant, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding sickle cell anemia.